Hello, I'm Dr. Briggs. I'm the Medical Director here at External Affairs, and today I'm going to talk about female sexual dysfunction. Female sexual dysfunction is commonly seen in women at various times during their life, and it's marked by a decrease in desire or decrease in sexual performance. When I first have a patient complaining of low sex drive, the first thing I have to do is to rule out any disease state. And the common disease states that I like to rule out are hypothyroidism or low thyroid, depression or anxiety disorders, increased stress, or other diseases like diabetes. As part of my thorough history, when I'm assessing a patient with low sexual desire, I like to rule out certain medications that the patient may be on. For example, antidepressants and anti-anxiety medications often alter dopamine and serotonin levels in the brain, which alter a woman's ability to have sexual desire and even sexual performance. Other medications like anti-seizure medications, antihistamines, oral contraceptive medication can all affect hormone levels within the brain or outside of the brain, affecting their ability to respond to sexual stimulation. We know that as women age, their hormone levels change as well. For example, some hormones like cortisol increase with aging. Other hormones such as testosterone, progesterone, and estrogen decrease with aging. When I look at estrogen, for example, in the absence of estrogen, women can develop vaginal dryness and painful intercourse, which is obviously going to affect their interest and ability to have sexual contact. In some cases, in younger women, oral contraceptive pills can alter estrogen levels with the same type of effects. With respect to testosterone, testosterone is extremely important in determining the degree of sex drive that women are going to have. As they age in their 30s and 40s, testosterone levels consistently decrease. With that comes a decrease in clitoral sensitivity and indeed clitoral size, as well as sex drive. So it's important to sometimes give testosterone to women who are complaining of these sorts of symptoms. Another important male hormone is called DHEA, which acts very similarly to testosterone in monitoring and moderating female sex drive. And finally, as women get older, oftentimes they lose the ability to orgasm, and we find that using hormones such as oxytocin can actually lead to a woman's reacquiring the ability to orgasm as they age. Some studies indicate that certain medications that men use to increase their sexual performance are also helpful in women, and these include medications like Cialis and Viagra, which lead to increased clitoral stimulation and size. There are certain supplements that you can buy in health food stores which are reputed to be able to help with sexual desire and sexual function as well. Rhodiola, for example, has been found to increase dopamine levels in the brain, which is intimately involved with increasing a woman's sexual desire. A couple of other supplements, including zinc at 15 to 25 milligrams per day and Tribulus terrestris at 100 milligrams 3 times per day, have been found to increase male hormone levels, which obviously are involved in increasing sex drive. And finally, there's a supplement called L-arginine at 6 grams per day, which has been found to increase nitric oxide levels in a way very similar to Cialis and Viagra, which can increase clitoral size and clitoral stimulation. So thank you so much for watching this week. It's been a pleasure being here talking to you about female sexual dysfunction. I hope you come back next week when we'll be talking about male sexual dysfunction. Thanks very much. I'm Dr. Briggs.